Welcome back to Insight. We're at Indiana Physical Therapy, and we're talking to Kristen here about frozen shoulder, huh?
Also called adhesive capsulitis.
I didn't call it that, no.
No. And it's just a condition where, for no known reason, it's considered an insidious onset, so no known trauma or cause, but the shoulder becomes painful and tight. And people notice over time that they're just not able to do the things that they were able to do before, like raising their arm up. They notice it a lot with kind of grooming, washing their hair, reaching behind their back into a back pocket. Women notice it a lot with trying to fasten their bra behind their back, that they were able to do it, and then progressively that shoulder just got tighter and tighter, and to the point where they weren't able to do it any longer.
Huh, okay, now that's, if there's no known cause, it feels like to a layman like me that there would be not necessarily any known treatment either, but obviously there is.
Yes, there is, and they actually show, the research shows that the earlier you can get into therapy, the better your outcome for restoring that motion sooner. Typically the shoulder pain, the stiffness can last up to 2 years, but we can kind of diminish that pain so it's not as significant if you can get into therapy earlier. Teach you some motions to do. We can do some passive motion, passive stretching of the shoulder, some joint mobilizations for that tightness that's progressed over time, even some soft tissue work, and then some strengthening for the shoulder, because typically if the shoulder hurts, you're not going to use it as much, which means everything's going to get a little bit weak.
Okay, so like I've noticed sometimes that it's, getting, as I get older, more and more difficult to scratch my back, but I thought it was because I was lifting weights and, something like that. You're saying it could be this frozen shoulder or something like that?
In that case, probably not. It's probably just you're not challenging that motion. Frozen shoulder, the big difference is when you actively try to lift your shoulder, lift your arm up, that the shoulder doesn't move, and also when someone else does it, or when you take your other arm and try to lift it up, it still won't move. So if you're trying to scratch your back and you use your other hand to pull it up, it's probably going to go a little bit farther. So in that case, probably not frozen shoulder.
So what's treatment look like then? You start with what? You start moving shoulder around?
We start with a passive motion, so I would stretch the arm up overhead. Rotation tends to be a challenging one. Internal rotation, so that reaching into the back pocket, fastening the bra. And then we can also do what we consider active assisted motion, which we set you up on pulleys, and you use the strong arm, the non-painful side, to kind of pull down on the pulley, which gives that other arm a good stretch overhead. Can teach you some other exercises lying on your back.
And I think you mentioned this, I just want to be clear. Does it happen all at once, or is it just...
It progresses, and it typically progresses over 3 phases. So initially, you just notice that you have some pain with those extremes of motion, reaching up overhead behind your back, and then progresses into the stiffness. You have pain at rest at that point, and then everything is getting tighter, and then finally moves into a phase where the pain starts to subside a little bit, but the stiffness continues until we kind of work that out a little bit.
Is the shoulder more complicated than maybe people realize, that there's a lot of different muscles working there?
The shoulder's made for mobility, so you notice when you have any type of loss that it could be coming from many different areas. It could be the neck, could be upper ribs, could be shoulder. Yeah, a lot of different factors play into what's going on within that shoulder joint itself.
So if people find themselves in that first phase where maybe it's painful to make some of those shoulder moves, probably better for you and them to come in here early.
Come and get it checked out. The first phase is the hardest phase to diagnose specifically as adhesive capsulitis, because it's just kind of this unknown pain at the end range motions. It's when you get into the second phase, which is when we tend to see people, that they start to get that stiffness, so we can be more accurate in saying, yeah, this is likely frozen shoulder.
All right, well, either way, no matter what the diagnosis, there's no reason to live with the pain. Come into Indiana Physical Therapy. You can find them online at indianapt.com. We'll be right back on Insight.